And coming to the hemopoiesis. What is meant by hemopoiesis? The formation of blood cells. That is called as hemopoiesis. From the basic, we are always seeing this flow chart, but we will always forget this flow chart. Okay, so the most origin of the hemopoietic cell is pluripotent hematopoietic stem cells. Stem cells is the one, the term pluripotent indicates it is giving rise to multiple cells. Okay, from the pluripotent hematopoietic stem cells, you are getting colony forming unit spleen. So it is the one which is going to the spleen, and the lymphocyte stem cell which is going to give rise to the lymphocytes. From the splenic colony forming unit cells, you will have the colony forming unit blast cells, and you will have the colony forming unit granulocyte monocytes, and the colony forming unit megakaryocytes. Okay, from the spleen colony forming unit, you will give rise to the colony forming unit blast cells. This further give rise to the colony forming unit erythrocytes, CFU erythrocytes, and from the spleen it will give rise to the granulocytes and monocytes. See, this is for erythrocytes, this is for granulocytes and monocytes, GM, M is for megakaryocytes. So erythrocytes give rise to RBC, G give rise to the granulocytes, M give rise to the monocytes. In the granulocytes, you have eosinophil, basophils and neutrophils, okay, which contains the granules. And then in the monocytes, it is also giving rise to the macrophages, okay, macrophages, and then the CFUM giving rise to the megakaryocytes, which give rise to the platelets in the formation. And from the lymphoid progenitor, you will have the T cells and the B cells. This T cells is further categorized into T helper cells, T cytotoxic cells and T suppressor cells. You will see all those things in the immunity. And B cells give rise to plasma cells and memory cells. These plasma cells give rise to the antibodies. Okay, clear? So this is what is hemopoiesis. From the pluripotent hematopoietic stem cells, you will get the lymphoid progenitor and the splenic progenitor, that is colony forming unit cells. This colony forming unit cells from the spleen give rise to the blast cells. This blast cells will give rise to the colony forming unit erythrocytes, which gives rise to the RBC, and CFU-GM, which give rise to granulocytes and monocytes. Monocytes also give rise to the macrophages, and the monocytes give rise to the megakaryocytes and the platelets. And the lymphoid progenitor give rise to T cells and the B cells. And now coming to the erythrocytes, which is also called as RBC, the red blood cells. Okay, this is the shape of the erythrocytes. It is either disc shape or biconcave shape. Okay, when you do the cross section, the interior, you will see the biconcave shape. This biconcave shape is maintained by the two specific proteins called as pectin and ankyrin. So this is the two specific proteins which is present in the RBC to maintain the biconcave shape of the RBC. The main peculiar feature of this biconcave shape of RBC is, see, this is the cell. And the RBC, because of this biconcave shape, it can easily penetrate from inside to the outside. Okay, so this biconcave shape of the RBC makes it to move from one side of the cell to the other side of the cell. That is one of the most important significance in the biconcave shape of the RBC. Why this biconcave shape is maintained only for the RBC is because this RBC is containing hemoglobin. That is the site where the oxygen and carbon dioxide exchange is taking place, which is the most important function which has to be maintained throughout our body. Oxygen carbon dioxide exchange is happening by binding with the hemoglobin which is present inside the RBC. So that is the most significance of this biconcave shape of the RBC. And also other advantages in the shape is it is resistant to the fragility. If the cell is not remaining in the biconcave shape, when it is squeezing from one side of the cell to the other side, there is more chance for the rupture. So this is remaining more resistant to the fragility of the membrane. And it also attains a parachute shape when it is present in the capillaries, so it can easily move inside the capillaries, that is like this. Okay, so when it is moving, the blood cells is flowing towards the blood capillaries, it will attain the parachute shape. And because of the biconcave shape, there is increased surface area for the availability of the cells, as well as when it is present inside the cell or within the blood flow. Okay, clear? And the main important functions of RBC is mainly involved in the gas exchange, oxygen and carbon dioxide exchange, and also involved in the nitric oxide exchange. And it is having a major role in the maintenance of acid-base balance. And this RBC is having a major role in maintaining the viscosity of the blood, the thickness of the blood. What is the condition when there is increase in the number of RBC? What do you call it as? What? Erythrocytosis, polycythemia, leukocytosis, thrombocytosis, mari erythrocytosis. Specifically, you will term it as polycythemia. The condition which decreases RBC is erythropenia, anemia. Okay, clear? And the lifespan of RBC is 120 days. We will see what happens after 120 days. Okay, so the production of RBC, it is also called as erythropoiesis. Hemopoiesis is overall all the cellular elements of the blood. Okay, and generally erythropoiesis is production of RBC. So RBC is main role is oxygen carbon dioxide exchange. So RBC has to be produced during the intrauterine life itself. Okay, so during the first trimester of pregnancy, the erythropoiesis is also happening in that period, that is called as mesoblastic stage. In the yolk sac itself, you will have the erythropoiesis production. And during the second trimester, the liver is being formed. So it is one of the reticuloendothelial structure. It takes parts of the role from the yolk sac to the hepatic stage. And then finally, during the third trimester, the myeloid stage, myeloid in the sense, not the muscles, bone marrow. Okay, so that is having its role in the production of erythropoiesis. So in that, in children up to 20 years, all the bones, liver and spleen is involved in the production of RBC. And then after 20 years, all the end of the long bones will take part its role. And then during emergency, that is called as red bone marrow. And in case of emergency conditions, when there is a heavy blood loss, hemorrhage, trauma, whatever may be the cause, when there is a heavy blood loss, first thing is decrease in the blood volume. Blood pressure is getting decreased, hypotension. Apart from that, because of decrease in RBC, you will encounter hypoxia. So in those emergency conditions, the yellow bone marrow will also do the function of red bone marrow in giving rise to more and more of erythropoiesis mechanism. Okay, so this is how the production is being maintained. So these are all the stages which is involved in the erythropoiesis. So first one is, here you have the pluripotent hematopoietic stem cell. So that is the pluripotent cell from the stem cell. So that give rise to the proerythroblast. First you remember these things, proerythroblast and basophil erythroblast, also called as early normoblast, and intermediate normoblast, also called as polychromatophil erythroblast. I will explain you why these different names. And then late normoblast called as orthochromic erythroblast, reticulocyte, erythrocyte. Okay, so this proerythroblast, it is the stage, that is the blast cells. We have seen in the colony forming unit spleen, blast cells. Okay, that is this proerythroblast. It is the cell which is having the biggest size. In this stage, you have to remember these things, very important. In questions, you will encounter which stage the nucleus disappears, nucleus starts appearing, all those things. So the chromatin opens. In the proerythroblast, the chromatin which is present inside over here opens. Okay, and next one is basophil erythroblast. Basophil erythroblast means usually the basophils are basic and they will remain blue in color. Okay, so that is called as basophil erythroblast. If you see all over here, the cytoplasm, it is bluish. That is called as basophilic. Eosinophilic means it will remain pinkish. Okay, that is the, what you see, if you do the staining mechanisms, so you will identify and differentiate the cells based upon the color as eosinophilic or basophilic. Because the stain what you are using to differentiate the cells in the pathology or in the microbiology, you will have acidic and basic stains. The basic stains will stain as blue and acidic will be stained as pink. Acidic you will also call it as eosinophilic and basic you will call it as basophilic. So here the nucleus is present and the cytoplasm is bluish in color, so it is called as basophilic erythroblast. This is the stage where the nucleus starts disappearing. It is not completely disappeared. So in the proerythroblast, you have a big nucleus and the chromatin starts opening. Okay, and the basophil erythroblast, which is also called as early normoblast. Okay, that is the stage where the nucleus starts disappearing. Okay, so still it is basophilic in nature. And the next to the basophil erythroblast is polychromatophil erythroblast. In the sense, it has both eosinophilic and basophilic appearance in the staining mechanism. Because since the nucleus is still present, not totally disappeared, but starts disappearing, so it will have both the feature. So polychromatophilic, chromo means color. It is having both acidic and basic nature. Eosinophilic pinkish as well as basophilic bluish. It is not in both the sides. It is in between. Okay, waveriform. So that is called as intermediate normoblast. So this is the stage where the hemoglobin starts appearing. Hemoglobin is giving which color to the cell? Since the hemoglobin started appearing, this is having this polychromatophilic nature. Before that, basophilic nature. Hemoglobin started appearing, so it is having the reddishness. So you have polychromatophilic appearance. This is more frequently asked question. In which stage of erythropoiesis hemoglobin starts appearing? Intermediate normoblast or polychromatophilic erythroblast. Okay, so this is very frequently asked 5-star question. Okay, and next one is orthochromatic erythroblast. So orthochromatic, no basophilic appearance, only eosinophilic appearance because nucleus totally disappeared. And the degradation of the nucleus, if you see here, it is like a cartwheel. Okay, like this, the cartwheel appearance. is being given, and the mitosis is no more after this stage. Okay, so these features is also very, very important. The cartwheel appearance is seen in late normoblast or orthochromatic erythroblast. And finally, reticulocyte. Okay, reticulocyte, totally there is no nucleus, hemoglobin is completely formed. Okay, but it is still bigger in size than that of the RBC. What is the normal size of RBC? 7.2 micrometers. Okay, so the reticulocyte is converted into a mature RBC. For this, you need a hormone. What is that? Without that, reticulocyte will not be converted into erythrocyte. One important hormone is required for this. Erythropoietin. From where this erythropoietin is produced? Kidney. So if a person is anemic, will you consider it is only because of blood disorder? If a person is having renal disease, also you will have anemia, and also you will have hypoxia. Okay, so the term anemia, that is why we are defining anemia. It is not a disease, it is a sign of a disease. Anemia is due to various disorders. If you have bone marrow disorder, you will have anemia. And if you have any red blood cell erythropoiesis disorder, or if you have any vitamin B12 deficiency, erythropoietin deficiency, so many factors will cause anemia. But you cannot determine if a person is anemic, it is only because of this. You cannot determine like that. Okay, so this reticulocyte to erythrocyte is, this conversion is taking place only in the presence of a hormone, erythropoietin. This erythropoietin is produced from the kidney. Okay, if the person is having renal disease, kidney failure, 100% the person will be anemic. You will be in a position to infuse iron sucrose, and you have to keep maintaining the RBC to prevent hypoxia. In this case, the person will have breathing difficulty because the person will be hypoxic if there is no RBC. Okay, you have to completely monitor, continuously monitor the RBC level, hemoglobin level in case of renal failure, or in case of permanent dialysis patients. You have to encounter this. That is not only the problem dealing with the renal system. It will have the co-symptoms with the hypoxia. You will have anemia and the other functions. What are all the functions maintained by RBC? Everything will get disturbed because there is no normal count of RBC. Okay, clear? That is what given over here. Lack of oxygen, hypoxia. Okay, because the renal cortex, it is the one which is taking part a major role. And the liver Kupffer cells, hepatocytes, it is also involved in compensating this. The erythropoietin production increases. This is the important hormone which is required for the erythropoiesis to complete, or else only reticulocyte will be in the circulation. In some cases, the reticulocyte count will be considered as an important laboratory parameter to find the conditions. Okay, and then this erythropoietin will immediately act on the red bone marrow. RBC production is increased, hemoglobin level is increased, the oxygen is restored back. This is in case of hypoxia. Okay, the hypoxia may be of whatever cause. This is how it is regulating. This is one of the negative feedback mechanism. Hypoxia is decrease of oxygen, and this decrease of oxygen is giving positive signal. Here there is deficiency. that is giving positive signal. Once when it is restored back, it will give the negative signal to stop producing excess of erythropoietin. Or else, if there is, after the oxygen is restored back, still there is positive signal, it results in polycythemia. This is one of the homeostatic mechanism to maintain the red blood cell count. And the other nutrients which is being carried out is carbohydrates for energy, and the fat for maintaining the cell membranes, and proteins for globin synthesis. RBC is containing the hemoglobin. Heme combining with the globin. It is one of the plasma protein. Okay, so if the protein deficiency, globin is not there, the RBC which is produced will be irregular shape and easily ruptured. Okay, clear? And the minerals. What are all the minerals which is required for maintaining the erythropoiesis? Not only the renal disease or not only erythropoietin deficiency will decrease the RBC count. If there is decrease of iron content in your body, they are the minerals which are of minor value. The value of the minerals what we need per day allowance is recommended daily allowance is very less. But the small deficiency of those minerals will result in major diseases. Example is the iron. If there is deficiency of iron, hemoglobin will not be formed. Hemoglobin is not formed, RBC is abnormal, easily ruptured before 120 days. And the copper, cobalt, mainly vitamin B12. Okay, in case of vitamin B12 deficiency, one of my friend, she encountered severe vitamin B12 deficiency, and she was like that girl before, and because of severe vitamin B12 deficiency, she became like a skeleton, and most of the persons did not identify the cause of it. She was being keep on infused with several units of blood, but only 2 days it was maintaining the hemoglobin level. Later on it is getting decreased to 7, 6 within 2 to 3 days. And then most of them, they are considering it as some kind of cancer. And she has also done the biopsy, and she has also given the bone marrow aspiration for assessing what kind of cancer. But finally it was diagnosed with severe vitamin B12 deficiency. And then after identifying it, she was supplemented with vitamin B12, and now she became normal. Okay, within 1 month, everything was becoming normal. Okay, so that is one of the first case which I have seen. She is my classmate and she has encountered this problem. She has done so many assessments, whether it is TB or any other abnormality, what kind of this, but everything, all the results is found to be normal. Finally, after bone marrow aspiration, her mother was crying. Oh, she might have cancer. What happened? And then finally, all the reports came normal, and it was found to be severe vitamin B12 deficiency. Okay, so that is how the minerals take part a major role. So all these, if the hemoglobin which is present inside the RBC, hemoglobin is not formed normally, iron deficiency and B12 deficiency, B6 deficiency, all these will show its reflection in the RBC, and all the functions whatever the RBC is doing will not happen. Okay, clear? And this is what I have explained. B12 and folic acid, they are the maturation factors from proerythroblast to the early normoblast stage. And other hormones, erythropoietin from the kidney we have seen. There are also other hormones, the thyroid hormones, adrenal cortex, which is producing the corticosteroids, sex hormones and growth hormones. These hormones also have its reflection in the erythropoiesis. Usually all these hormones have its reflection in all the production mechanisms. Okay. And now coming to the erythrocytosis, the physiological variation, okay, increase. Usually you will see the increase of erythropoiesis in high altitudes. Why? Why? Why hypoxia is encountered in resulting increase of RBC? Less oxygen level, that is hypoxia. We will see that when we are talking with the respiratory system. Okay, in detail, you will see the high altitude variations. And in case of newborns and infants, in newborn and infants, in the hemoglobin, usually adults will have alpha 2 and beta 2 subunits. But in case of infants, they have alpha 2 and gamma 2 subunits. So this is the specific peculiar feature which is seen in the fetal hemoglobin. So this fetal hemoglobin, which is having gamma subunit instead of this beta subunit, it is having the higher impact in hemoglobin oxygen dissociation curve. So that is the reason why fetal hemoglobin, newborn and infants have increase of RBC count. Okay, so they are the physiological variations. If a person is remaining in high altitudes and when they come to the normal sea level, the increase of RBC will come back to the normal. And the infants and the newborns, as the days goes on, automatically RBC count comes back to the normal. And when you are doing severe muscular exercises, because of increase in the oxygen demand to the muscles metabolic rate, there will be increase of RBC count. And after the resting period, it comes back to the normal level. And in case of male, there will be increase of RBC count. Why? Because of testosterone. Testosterone is the one which is required for maintaining the muscle mass in the male. So there is more and more requirement for oxygen that increases the RBC count in male. Okay, and physiological factors which decreases the RBC count is in children, in pregnancy and old age. Okay, clear? And some pathological variations. What you have seen increase is polycythemia vera. In case of persons with congenital heart diseases, chronic lung diseases, to compensate the hypoxic condition, there will be increase of RBC count. In case of leukemia and in case of Cushing syndrome, that is dealing with the adrenals, which is having some negative feedback mechanism because the adrenal hormones is having the role in the maturation mechanism. And thyroid, hyperthyroidism also having the major role. If there is increase of thyroid hormone, that also gives more positive signal for the erythropoiesis, resulting in increase of RBC. Okay. And decrease of RBC, you will consider it as anemia. And now coming to the hemoglobin. Hemoglobin is the red color pigment which is giving red color to the blood. Okay, so this is the structure of hemoglobin. In the center you have the iron surrounded by polyporphyrin ring. Okay, so each ring has the subunit. You have 4 molecules of pyrrole rings and that gives rise to hemoglobin structure. And each ring gives rise to the attachment of oxygen. So 1 unit of hemoglobin can attach with 4 molecules of oxygen. Okay. And now the types of hemoglobin. Normally you have 2 types. We have seen, that is alpha 2 and beta 2 in the adults, and in the fetal you have gamma instead of beta. This gamma is having more affinity with the oxygen than compared to the beta subunit. That is the specific significance in the fetal hemoglobin. And abnormal hemoglobins like hemoglobin A2, 2A2 delta, Hemoglobin, yes, that is what you encounter in sickle cell anemia. And hemoglobin lysine. So these are some abnormal hemoglobins. And what happens to the RBC after 120 days? Okay, so once when the erythropoiesis is formed, after 120 days, they become aged, damaged. RBCs, where it is getting damaged in the reticular endothelial system of the liver, spleen, lymph nodes. Okay, so all these places, when the this is the RBC structure. Inside you have hemoglobin. This is splitted off into heme and globin. This globin is an amino acid which enters into the circulation and it is being utilized for other properties. And this heme further splitted into bilirubin and iron. This iron is utilized back for the erythropoiesis. And then some amount of iron will come out and bind with the transferrin. The iron is stored in the form of transferrin. Okay, so this is frequently asked. The storage form of iron is transferrin. It is stored in the spleen. Okay, and this bilirubin, it will enter into the liver and it will bind with albumin. So that forms bilirubin, and the iron also enters into the liver as ferritin, which is utilized back for the erythropoiesis mechanism. And this bilirubin, whatever is entered into the liver, it will be one of the content in the bile, which is giving yellowish color to the bile. Okay, and after that, what is happening is this bilirubin, how it is excreted is this enters into the kidney and it is converted into urobilinogen, and into the intestine it is converted into stercobilinogen. So because of the presence of the bilirubin in the form of stercobilinogen, the feces is having yellowish color, and the urine is also slightly yellowish because of the presence of urobilinogen. Okay, clear? And if there is excess of hemoglobin degradation, if there is excess of RBC degradation, then what happens? It results in excessive production of bilirubin. So all the bilirubin cannot be excreted at a stretch. So these bilirubin will get accumulated in the body, and that is what we are encountering as jaundice, the yellowish discoloration of the skin. Mainly you can see in the eyes, conjunctiva of the eyes, and all over the skin becomes yellowish if it is severely jaundiced condition. Okay, and that jaundice we can categorize as how? Hepatic, pre-hepatic, post-hepatic, as obstructive and non-obstructive jaundice. For example, from the liver, if there is any obstruction in the excretory mechanism, that is post-hepatic. And pre-hepatic, for example, if the person is having abnormal RBC or abnormal hemoglobin, there will be excessive degradation of RBC before 120 days. So the liver will not be in a condition to cope up with the enormous amount of bilirubin which is coming by excessive breakdown of RBC, that is pre-hepatic. And if there is any liver disease, liver cirrhosis or any other kind of liver function is not good, then the liver will not be able to excrete the bilirubin properly. So that is how you are categorizing the jaundice as pre-hepatic, hepatic and post-hepatic. Okay, so this will be identified based on conjugated and unconjugated bilirubin. The conjugation is taking place in the liver. If you are finding unconjugated bilirubin, then it is of pre-hepatic cause. Or if you are finding conjugated bilirubin to be in excess, then it might be either post-hepatic cause. And if you do with other liver function parameters, plasma protein levels, still you have all these jaundice, then that is due to abnormal liver function. LFT will give you, liver function test will give you the assessment. Okay, so this is how you will categorize jaundice. So jaundice is due to abnormal RBC, abnormal hemoglobin, or liver disease, or any pathway defect, obstruction from liver to the urine or to the intestinal defects. Okay, clear? So that is fate of hemoglobin. Up to this, RBC is over.